Hi, welcome this week to The Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
We have a great show for you today. So many people ask us about cholesterol all the time. Big topic.
Yeah, it's I think something that a lot of people are misinformed about, which I think is a super duper pertinent thing to have accurate, information on when it comes to your hormones and your health and stuff. So
yeah, absolutely. As a traditional doctor, it's really interesting, all the conditioning and the fear that come around cholesterol. So we want to bust that myth for you today. So we've got a couple different segments. We're going to show you a new perspective on that, and hopefully you'll look differently at cholesterol after that.
Yeah, I know that most people don't know that cholesterol is a hormone, yeah, which is, directly related to testosterone. Well, I guess not directly, but it's
absolutely. Yeah, you can say directly. That's okay.
It has to go through a couple other hormones before it gets to testosterone, right? But yeah, seems like a lot of patients that we see with, there's like they may be taking medicine for, the cholesterol being high, and it's just making their testosterone fall deeper and deeper into the hole.
Absolutely. It's a multi-billion-dollar business, the statins and the cholesterol meds. And that's my disclaimers. Don't stop any meds based on what we say here today, but rather take a more informed approach at the way you look at anything in traditional medicine, right? We're the Naked Doctor, the naked truth about health, wellness, and lifestyle. So I think we have to ask those questions. Questions are important, and we don't just do things because that's what's always been done.
Well, I think that most people, especially when it comes to a doctor, that's probably exactly what the underlying, why it continues to stay in the same path that it's been in, because people, as somebody who doesn't know, anything about cholesterol, and we only know what we've been told, and we didn't study medicine or we're like, we go to you or any other doctor to tell us what you learned all those years that you studied.
Yeah.
It's like we would of course trust wholeheartedly 100% that the information that we're getting from you is accurate, and not that anybody is trying to give inaccurate information. It's just that for whatever reason at that point things just kind of got misconstrued and misinformed, and it kind of just like a lot of other things went into the world of greed and went from a way that you could actually solve a problem to actually creating more problems.
Yes, I love that perspective.
More problems, more money.
Yeah, exactly.
Not more money, more problems. More problems, more money.
I just had a patient's wife text me this week in a total panic. They just checked her husband's cholesterol at the other doctor's office of primary care, thinking he's going to have a heart attack this week. We got to get him in. We got to get this down. We got to talk about this. So I'm going to give you a little bit different perspective if you're worried about cholesterol, and I'm going to tell you that cholesterol is a good guy, and I'm going to show you why, and that you don't have to be worried and scared. The problems with, if you're worried about the endpoint of cholesterol being a heart attack or stroke, which is what they use to induce fear, is inflammation and sugar and obesity and toxins are all what cause that. And genetics have a component too. So it's really not the cholesterol at all. So we're going to talk about that when we come back. So we're going to take a little break, and we'll spell all those myths for you when we get back.
I have osteoarthritis, and the arthritis medication that you get regularly will cause your kidney function to go down, and my kidney function had started going down, and so I knew I needed to do something different. I've been seeing Dr. Tammy for about 3 months, and she's been doing stem cells in my knees, and it's like a miracle. She absolutely hits it every time in the correct spot, and I am pain-free now, and I haven't been pain-free for about 10 years. I can go upstairs without pain. It's wonderful. And I send everybody I know to her because she's done such a wonderful job for me, and I just appreciate it so much.
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
We have a great show for you today, the cholesterol show.
Yes. So one of our, we had a patient in last week who was, she talked about how, she wanted us to do a cholesterol test. And
oh yeah, I forgot about that one. Yeah. Mm-hmm.
And you came in and because, there's a little bit about hormones that I can explain to people, but I knew that when you came in there, you'd be able to, break all that down for her. But I learned so much just listening to you talk to her and giving the spiel about the industry and about the levels and about how they've changed the levels and why and all those things. So I think that that's super awesome information that we should definitely share.
Mm-hmm. I think giving you my perspective on how this came to be. So as a traditional medical doctor, before I kind of got into this wellness functional medicine world, when I was in residency, one of the interesting things was that the pharmaceutical companies would come in and literally buy the doctors, court them. I mean, almost like a mating ritual, right? And so they would buy them expensive trips and golf trips and watches and just amazing, like cruises. I mean, it was just ridiculous. And so one time I went to this drug dinner, we called them, and really doctors just become glorified drug dealers because we get so into this cycle, right? So at this dinner, the doctor who's giving the speaking engagement actually starts talking about all this fear and talks about cholesterol as this fatty globule in the arteries, right, to cause a heart attack or stroke. And if you don't put and shows all this data, of course, from the pharmaceutical companies, right? Mm-hmm. So it's skewed data, and says if you don't put your patients on this cholesterol medication, we have a fix for that, right? That they could sue you if they have a heart attack or stroke for your neglect. And so, the thought of getting sued as a physician malpractice, right?
So not only are you putting the patients in fear, we have somebody putting the doctors in fear.
Absolutely.
So it's a fear train.
Yeah. And I hadn't even made my first $1 as a physician yet. So I'm like, I tell you, this is true story. I went to work the very next day. I'm a resident, we're in those little cubicles. We're not like, we're real doctors, but, we're still kind of in training. Mm-hmm. And I had my nurse go back in the computer and find every patient who even had a couple points over a normal cholesterol level. And I'm like, you call these people and you get them on cholesterol medication. I didn't know any different.
Right.
I didn't know it was a hormone. I didn't know how it works in the body. So two things with that. One is, when do they check your cholesterol? When you're menopausal or andropausal, when your hormones start to decline. So I'm going to explain why that happens and what that really means. So, of course, when your hormones are starting to decline, the liver makes most of your cholesterol. It's not even dietary. The liver creates its own cholesterol because it is actually a hormone that's making your other hormones. So when the other hormones decline, of course, your liver's going to pump out more cholesterol. The other thing with that, and instead of fixing the underlying cause, the hormone issue, of course they want to put you on medicine. And if they block that cholesterol hormone, you can't make your other hormones. So there's lots of more pills.
Everything else after that.
Yeah. And the other thing is they've literally changed the numbers over the years. So it used to be a cholesterol level of 290 was, quote, normal. And then they changed it to like 220, and now it's 200. So the point at which doctors are fearfully inclined to start, we call it CYA, cover your butt, fearfully inclined to start patients on these medications is much, that the range is much tighter now.
Right. It's like, let's reel in some almost.
Yeah.
We need some more money.
Yeah.
We need to put more people in this process, in this system. More customers.
More customers. Mm-hmm.
Sorry, continue, but it's kind of aggravating.
Well, the problem with that is it's not a benign pathway because these statins, these medications, again, this is not, you have to make your own decision, but these statins have so many side effects. They think up to 80% of people on these statins have some form of side effect. And so these medications actually work on the liver because your liver makes most of your cholesterol to make your hormones. It has a function to do that. That's not a bad thing. And so what they do is they go into the liver in this kind of complicated process. I won't get into all the terminology there, but it goes in the liver and it blocks a pathway of which your body makes cholesterol. So in that process, there's a bunch of diverted byproducts of inflammatory type substances that get made there. So I always tell people, if you are going to take a statin, make sure you're taking CoQ10, which is a supplement that helps smooth that pathway over and keeps you from diverting some of those toxins and chemicals in that inflammatory pathway. So
what is that, like CoQ10? What is that specifically? Is it for inflammation, or what is it specifically?
Yeah, it can be used for inflammation, but most inflammation is produced as the liver is filtering toxins.
What else would it be used for, like CoQ10? Because you kind of gave us like the underlying of that process or whatever. Was it made for people who were taking these supplements? I mean, these medicines for cholesterol?
Well, it wasn't specifically made for that, but what we know is as we've dissected the organic chemistry, which it's funny how applicable organic chemistry is for me now. When I actually took the class, I almost flunked it because I didn't understand how important it was. But if you look at the pathway, it's called the cytochrome P450 system. You don't need to know that. But in that pathway, as the liver detoxifies, it uses CoQ10 as a cofactor. Q10 is actually a cofactor, that's what the co stands for, that actually helps kind of metabolize, if you will, or transition these toxins through.
Okay.
So as it's processing, the statin medication is actually sort of toxic to the process. It kind of helps that pathway. And when you have toxins build up in the liver, then you have inflammation build up the rest of the body. So,
which causes all kinds of issues.
Right. Well, then you've got a medicine for, the inflammation, for the pain. You got pain pills. Now you have brain fog. Your hormones are low, so everything is off balance. And then you kind of just have to start from scratch by treating side effects and all the things that come with those medications.
I know that this may be your Blackboard segment, but the process that you showed me, that I see you show a lot of patients where, with cholesterol and the process that it goes through, and then by the time that it gets to your testosterone, is that what you're going to do for the Blackboard?
Yeah.
Okay.
Yeah.
I was going to say, otherwise you'd need to explain it. I was like, because that process is so amazing, like, you just never know that was the issue.
Most people are amazed when they see this process that I'm going to share with you too. They're like, I had no idea.
Yeah, and it's interesting too because you hear a lot about people. It's like this, he said, she said. It's like you hear all these bad things about hormones, right? And all these things are not true.
Oh, they think estrogen, they think cancer.
Yeah, it's like people have
many myths.
I had somebody the other day tell me she's like, oh yeah, I'm scared of to do any hormones because I had cancer. And I was like, you actually are a prime candidate to come in because that's probably what caused your cancer was an imbalance of your hormones. Yes. I was like, we have patients who have had cancer all the time come in, and I was like, they're doing hormones and getting their body back in balance and stuff. But it's interesting because it's like, okay, did the cholesterol industry,
create the cancer industry, or at least a part of it?
Yeah, it's like create like the anti-hormone treatment industry. You know what I mean? It's like, because it's not like
it's all propaganda too. That got everybody scared of hormones too.
Right.
So that's a whole other show and a whole other story.
Well, it's like everyone's scared of their actual cure, right? Something that will actually cure them, so that they will take these things that will keep them in the financial greed loop,
the insurance loop, the medication loop.
And it's it's got to go through every hand. Everybody's got to have a piece of the pie. It's got to and it's like, or you go to one place, get your hormones fixed, and get rid of all your
it all magically goes away.
Get rid of pretty much all of your medications.
And when you treat the hormones, all their cholesterol problems balance out. Not that that's a risk factor for a heart attack or stroke anyway, but it's like, if that's a parameter that you're using for your health, it balances all out.
So you were talking about something that I thought was really interesting that you were telling one of our patients, was that you were explaining how with cholesterol and you were talking about for some reason you started talking about calcium and how it deposits in the bones without having vitamin D, and that has something to do with cholesterol, because you were talking about heart attacks, where the heart attacks would actually come from, but it's not actually the cholesterol. So yeah, what exactly was that?
Okay, that said, there is a good cholesterol called HDL. I always think of H for happy. There's a good kind of cholesterol that literally does grease up, if you will, kind of like Teflon in the arteries that keeps things from sticking. So the things that stick, that actually block the artery, that causes the heart attack or stroke, right? Because that's a blockage of blood flow to that muscle or that organ.
It's not the cholesterol.
It's not the cholesterol. That actually smooths it out. So what actually sticks is sugar actually causes like potholes in the pipe, basically. And then other things like calcium deposits can, because they talk about CT scoring calcium, you might have heard of that. So actually what happens is that calcium deposits in there. So as we age, if you don't have hormone balance, estrogen and vitamin D help put calcium into the bones. If it's sitting in your arteries, it's like rocks in a pipe, like a sewage pipe. It's like blocking it up.
So it's almost like, excess sugar and all those types of things, calcium and stuff like that. It's almost like your cholesterol is actually high because it's trying to keep up with the fluidity of the sugar and all the stuff to try to get through your arteries.
That's why we're seeing so much more high cholesterol too.
That makes sense.
And it gets depleted. Your happy cholesterol gets depleted because it's being used up to lubricate
it's like
these
I only
arteries.
got so much that I can give.
And then the HDL's low, and then the other parameters go out of whack. So there's not really time for us to talk about all the aspects of cholesterol because, I could go on and on.
I can listen on and on.
There are other components of the lipid panel like triglycerides and your LDL and all those and the ratios. But what you want is you want a lot of the good stuff and maybe minimize some of the other things. However, LDL, they call the lousy, is actually the substrate, and I'm going to talk about that in the next Blackboard segment, is actually the hormone that makes your other hormones. So even what they call the lousy cholesterol is not lousy.
So it creates the H. What's the H? What is the letters?
HDL is the high
HDL.
density. So there's different densities of these cholesterol
Gotcha.
molecules.
But you have to have one to have the other.
Right.
So
It's
just like
breakdown products.
anything, you got to go through the bad to get through the good.
Yeah, I love it. Yeah, that's so true. We're going to talk about that in the relationship series, right? That's coming up.
Yes.
All right. So again, there's so much. This is so in depth. But if I could leave you with anything, it's that do your homework. There was that story about the lady who always left the end of her pork loin off, and it was like after she asked her mom and her grandma, because that's what they always did, is because the pan was too small. So it's like, don't just do it because someone told you to do it. Do your research. Again, don't stop your cholesterol medication. There's actually some thought that there's an anti-inflammatory component of statins, so there may be some benefit there, but
yet isn't inflammation what it actually causes?
Yeah, well, it's kind of a vicious cycle. So I love fish oil, which actually increases your good cholesterol, good fats like avocados and almonds, things like that. So you need good fatty acids. They're super important. And if you need a higher HDL to negate the effects of any possibility of anything else being sticky in there causing problems. Gotcha. Which I don't even believe that, but some people do. So if you're going to fight that game with your doctor, talk about the inflammation, talk about the underlying cause, talk about the hormone imbalances. A heart attack or a stroke is not a statin deficiency, kind of like a headache is not an aspirin deficiency. Get to the underlying cause and get to somebody who actually knows what they're talking about and aren't just buying into the pharmaceutical companies. Okay, time for a little break. We're going to come back with a Blackboard segment and show you some really super cool stuff. Hey, Dr. Tammy here. We're going to do the Blackboard segment, and I'm going to explain a new perspective on cholesterol that you might not have ever had before. So let me just write out the word here, cholesterol. Everybody knows this word. But what they might not know is that this part of the word sterol is actually a hormone. So what is a hormone? Hormones dictate every process that happens in your body. Most people think estrogen, they think hormone, they think bad, they think cancer. But there are literally thousands of hormones in your body that do all sorts of things. And it's the balance that is so important to your health and to not get cancer. So sterol, this part of this word is actually a hormone. And the sterols, kind of like steroids, right, makes a hormone called progesterone. And progesterone is the first hormone in this pathway. Well, there's a couple others here, actually, like pregnenolone. But in this pathway, progesterone is kind of the next big hormone that's made. And progesterone stands for progestation, so it's very important for fertility issues. It's very important for sleep, for weight distribution. So if you're gaining weight after menopause or can't sleep or you have mood imbalances, progesterone is huge for that. Progesterone then converts into your estrogens. And I say estrogens because there are different forms of estrogens. Some are a little bit more problematic if they're in excess. Like if you're a 9-year-old girl wanting to grow breasts, you need these more proliferative type estrogens. If you're a menopausal woman, proliferation or growth in the breast could cause tumor or cancer. So it's all about balance, and estrogen is not bad. In fact, estrogen is essential to keeping the arteries healthy and keeping the calcium, like we said, out of the arteries and in the bones, so you don't break your bones or get fractures and things like that. So it's all about balance. And then estrogen converts to testosterone with a lot of other hormones in between, but this is just kind of keeping it simple. And then the sterol actually makes your cortisol. And I always tell people that if you have sort of this part of the balance and this part of the balance and you are on a seesaw, you know, if this part of the seesaw goes down, ooh, you get like the butt bump basically if these hormones are not balanced. So with cortisol, if this is too high or too low, you can get more of a stress response or less of a stress response, cortisol belly, and you can have all sorts of weight imbalances and things like that. So what happens is around menopause, age 45 to 50, or perimenopause, or in men we call it andropause, when their hormones start to decline, the liver starts pumping out more cholesterol to compensate for making more hormones. So that's the time when the pharmaceutical companies know that your cholesterol is actually going to increase, because these hormones have to be made from the deficiency that's going on. And so if they give you a medication to block your cholesterol, you're not going to make these hormones. And this is actually the LDL, or what they call the low density or lousy. So this is not bad cholesterol. It actually is used to make your other hormones. So HDL, like we talked about, actually works to lubricate the arteries. So you need your hormone balance to keep the inflammation low, and inflammation is what actually causes the heart attacks and strokes. So that's how all of this is related. So you literally need your cholesterol for these processes. And really what we need to look at is, when you look at the arteries, we want to work on decreasing the inflammation in the arteries so that you have good blood flow to the heart and the brain and all your other organs as well. So estrogen also helps put calcium into the bones, out of the arteries, because if calcium is allowed to deposit in the arteries, it's like little rocks in the artery and can cause blockages of flow. So normally it comes through here, but now it's like blocked. And if that happens, you get a heart attack, right? Because you're not getting blood flow to the muscle. And so the other things that cause inflammation are toxins, hormone imbalances. Sugar is huge, because sugar actually makes like these like potholes that these calcium deposits can then collect in. And one of the other things I like to tell people is vitamin D actually helps put calcium in the bones as well. And vitamin D regulates these carrier proteins of which these hormones travel around in your body. So they're all really important. All these levels can be checked, monitored, and you can be educated about this, and you can really affect how your body works optimally so that you don't have those endpoint issues that you're scared of, like heart attacks or stroke. And all of this is also related to aging. So very important. And there is some evidence that some of the medications for cholesterol can actually help with inflammation, but I love actually helping people get their HDL high, helping them take dietary fiber to absorb or block any of the bad fats that we take in, just because it can cause more weight gain as well if you eat a lot of sugar. That puts that fat storage on. So from a health standpoint, there are lots of reasons to regulate different aspects of your lipid panel, which is all the different types of cholesterol. So it's very important. You don't have to understand all this, but just know that, again, cholesterol elevation is not a cholesterol medication deficiency. The underlying cause is some hormone imbalance. So hope this was helpful. I love this stuff. This is really interesting to me. Hope it's interesting to you and that you got a new perspective. Hi guys, hope you have enjoyed this episode of The Naked Doctor and been enlightened and educated, and you have a new perspective on things. Again, not telling you to stop your medications, but yet to make an informed decision, dialogue, conversation with your doctor, and if they are resistant to this conversation, find somebody who will have this conversation with you, who actually understands the physiology and can help you find the underlying cause and the balance.
Yeah, it's just that starts with that awareness, you know. It's
Absolutely.
like, here's the information, here's the education, here's the, you know, here's the explanation that makes complete sense, you know, when you, and whoa, like epiphany, or mind blown, you know. And you know, now it's just a matter of what you do with it. And because most doctors, they're gonna probably tell you the same thing you've been hearing, but it's not for any reason, but just because that's the only way that they know as well. And it's not like they're trying to be
mislead
yeah,
you.
they're not trying to be greedy. Yeah, they're trying to help. Exactly.
And they're busy, and they don't always have the time to be motivated to understand these things.
And sometimes it takes it personally happening to you.
Yeah, right.
Which is why. I mean,
that's the only reason I know this stuff, because I had to know it because of my hormone issues. So yeah, absolutely.
Exactly, because you would have still probably been in the same position you were in. So yeah, just, you know, keep that in mind. And if you can't get the information that you need from the doctors that you have right now, just, like you said, do your research. And you know, we have infinite access to information and you know, things that can empower you. So
knowledge is power. Check out our website at healingartcenters.com for more information, or if you want to come visit us and talk about these kinds of things, have this dialogue, and come up with a plan.
Yes. Or you can go to, we have 2 Facebook pages with the Healing Art Centers and Dr. Tammy's Healing Art Centers, and also the Naked Doctor Show, and both of those on Instagram as well. So yeah, send us a message, or you know, call us 1-800-479-6435. All the information will be obviously in a graphic as well. So yeah, just come see us and get
and
things
we have an
tested.
art studio. We still have our art from our art show in the back, and Jane, our art teacher, is absolutely amazing. So we have art classes on Monday nights. So if you want to do some healing art therapy, or just build some confidence,
or just come and hang out and have a good time and paint. And I didn't know I could paint, but I can.
I didn't either.
Because Jane's awesome and she is such a good teacher. So seriously, the people are like, "Oh, I'm not creative." Yes, you are.
Yes,
everybody is creative. You have it. You are absolutely, everything about you is a creation. So yeah, come discover what you a place in you that you've never even tiptoed into. So we have a lot of fun. So yeah.
So I hope you've learned a lot about cholesterol today. We love you all very much. Have a blessed week, and we'll see you back here on The Naked Doctor.
Thanks for watching.